I don't even know why I booked this, really. I just haven't felt like myself for a while, and I can't put my finger on why.
That's a completely valid reason to book. Can you tell me a bit more about what not feeling like yourself has looked like? Welcome to Medical Voices. I'm Tom.
And I'm Nadia. Welcome back.
Same as last week, we'll drop you straight into today's consultation, then unpack the language afterwards.
Today we're back at Elmwood Surgery, a booked mental health appointment, not an emergency, with someone you'll recognise from last week's call. And as always, this is for language practice, not medical advice.
Nadia, you're Emma again. This time it's your own appointment, not Jamie's.
And Tom, you're Femi, the practice's mental health practitioner. Today, it's a much calmer room than an NHS 111 call.
And stick around to the end. Emma's about to show you how she got a therapy appointment in the UK without ever going through her GP. Let's get into it. Emma, hello. Come in, take a seat. It's nice to meet you properly.
Thank you. I feel a bit silly being here, to be honest.
Not silly at all. Before we start, how's Jamie doing? I saw the note about the 111 call a few weeks back.
He's fine, actually. Bounced right back. Thank you for asking.
That's good to hear. And how about you? I can see you've booked this appointment for yourself today, so what's brought you in?
I don't even know why I booked this, really. I just haven't felt like myself for a while, and I can't put my finger on why.
That's a completely valid reason to book. Can you tell me a bit more about what not feeling like yourself has looked like?
Just flat. I wake up and I'm already tired. I used to be someone who got up and got on with things. Now it takes everything I've got just to get Jamie to nursery and get through the day.
And how long have you been feeling like this?
About 6 weeks, maybe a bit longer. I kept thinking it would pass, like a bad patch, but it hasn't.
6 weeks is a long time to feel that way. What you're describing, that persistent flatness, that sense of just getting through rather than living, clinicians would call that low mood. It's more than a bad day, it's a pattern, and it's exactly the kind of thing worth talking about.
I suppose I just thought everyone feels like this with a young child.
Some of it may well be connected to the demands of having a small child, and we'll come to that. But the fact that it's lasted this long, and that you notice the difference from how you used to feel, that's important. Can I ask about your sleep? What's that been like?
Awful. I can't switch off. I'll be exhausted by 9 o'clock, but then I lie there and my mind just won't stop. And I've been waking up at 4 most mornings, and I can't get back to sleep.
So, difficulty falling asleep and early waking. We call that sleep disturbance. And it's one of the things I always ask about because it affects everything else. What about eating? Has your appetite changed at all?
I'm not really hungry. I eat because I know I should, but nothing tastes like much. I've probably lost a bit of weight, but I haven't been paying attention.
That's helpful to know. Appetite changes, whether eating more or eating less, are one of the ways we understand how things are affecting you day to day. And what about your concentration? Are you finding it harder to focus on things?
Yes, I'll start reading Jamie a bedtime story and realise I've read the same page twice without taking any of it in. At work, I keep losing track of what I'm doing mid-task. My manager hasn't said anything, but I know it's slipping.
That sounds really tough. Losing your concentration like that, on top of broken sleep and low appetite, that's a lot to carry.
It is. I keep telling myself to just push through it, but pushing through isn't working anymore.
You mentioned worry earlier, that your mind won't switch off at night. Has that been happening during the day as well? A sense of worry or unease that doesn't seem to have one specific cause?
Yes, it's like this background hum of, I don't even know what. Not panic, more like dread. Like something bad is about to happen, but I can't tell you what.
That persistent sense of dread or unease, especially when there isn't one clear reason for it, is what we call anxiety. It often sits alongside low mood, and they can feed into each other. The poor sleep makes the worry worse. The worry makes the sleep worse. It's a cycle. And it's not something you should have to just push through. Can I ask what you've been doing so far to get through the days that feel hardest? Sometimes people have coping strategies they don't even realize they're using.
I go for a walk after I drop Jamie off, if I can face it. And I ring my sister most evenings. She doesn't know how bad it's been, but hearing her voice helps.
Those are good things, and I'm glad you have them. Walking and staying connected to someone you trust, those are real coping strategies, and they matter. I don't want you to think that because they haven't fixed it, they aren't worth doing. Emma, I want to be open with you about where I think we are. What you've described today, the low mood, the anxiety, the sleep disturbance, the appetite changes, the difficulty concentrating, this could be a number of things, and I'd rather we explore that together than put a label on it today. What I'd like to do is talk you through some options.
Okay.
There's something called talking therapy. It's a structured way of working through what you're feeling with a trained therapist, through conversation rather than medication. The most common form is CBT, cognitive behavioral therapy, which looks at the connection between the way you think, the way you feel, and the way you behave. It's often the first step, and for a lot of people, it makes a real difference.
Would I need to come back here and get referred?
No, actually. This is one of those services you can refer yourself to. It's called a self-referral. You don't need a GP appointment or a letter from me. NHS Talking Therapies is a genuine self-referral service, and we can actually start that together right now, in this room if you'd like.
Quick aside, med nomads. If you run mental health assessments yourself, what's harder to get right? Asking one question at a time, or finding words that validate without sounding scripted? Drop your answer in the comments.
The goal here isn't to fix everything in one appointment. It's your well-being, your overall sense of being comfortable and healthy and able to cope. And that's something we build toward, not something we switch on.
That actually makes me feel better. I thought you were going to tell me there's something really wrong.
There's nothing here that tells me you need to be worried about today, but there is something here that's worth getting proper support for. So let's make a plan. We'll start the self-referral now, and I'd like to book you a follow-up appointment in 4 weeks so we can check in and see how you're feeling. Not an open-ended, come back if things don't improve, a specific date, a specific appointment in the diary.
A follow-up plan. I like that. It feels like something solid.
That's exactly what it is. You've done something really important today by coming in. And you're leaving with a plan, not just advice.
Thank you, Femi. I actually feel lighter than I did 20 minutes ago.
That's what this room is for.
I don't even know why I booked this, really. I just haven't felt like myself for a while, and I can't put my finger on why.
That's a completely valid reason to book. Can you tell me a bit more about what not feeling like yourself has looked like? That sounds really tough. Losing your concentration like that, on top of broken sleep and low appetite, that's a lot to carry.
It is. I keep telling myself to just push through it, but pushing through isn't working anymore.
What you've described today, the low mood, the anxiety, the sleep disturbance, the appetite changes, the difficulty concentrating, this could be a number of things. And I'd rather we explore that together than put a label on it today. Let's go back and decode the language you just heard. 10 terms from that consultation. Term, definition, one example.
Pause and repeat whenever you want to.
Term 1. Low mood. A persistent flatness or sadness that doesn't lift. Not a passing bad day, and not a clinical diagnosis. You heard the patient describe it as not feeling like myself before the clinician introduced the clinical term. Example: she's been experiencing low mood for approximately 6 weeks.
Term 2. Anxiety. An-xi-a-ty. A persistent sense of worry or dread, often without one clear cause. The patient called it a background hum of dread. The clinician named it. Example: the anxiety has been affecting her sleep and concentration.
Term 3. Sleep disturbance. A clinical umbrella for any disruption to normal sleep, difficulty falling asleep, waking repeatedly, or waking too early. Example: are you experiencing any sleep disturbance at the moment?
Term 4. Appetite changes. Either a reduced or increased desire to eat, asked about as a standard functional impact question. Example: have you noticed any appetite changes recently?
Term 5. Concentration. The ability to sustain attention on a task. You heard a concrete example in the consultation, rereading the same page, losing track mid-task. Example: she reported difficulty with concentration at work.
Term 6. Coping strategies. The practical things a person already does, consciously or not, to manage difficult feelings. The clinician asked about these respectfully, not as if they were absent. Example: what coping strategies have you been using so far?
Term 7. Talking therapy, also called CBT, cognitive behavioral therapy. Structured psychological treatment through conversation, not medication. Example: we'd like to offer you a course of talking therapy.
Term 8. Self-referral. A referral the patient can initiate directly without a GP or a clinician's letter. We'll cover how this works in different countries in the breakdown. Example: you can make a self-referral to the service.
Term 9. Well-being. Well-being. A person's overall state of being comfortable, healthy, and content. One compound word in UK English. Example: the focus of today's appointment is your well-being.
Term 10. Follow-up plan. A specific, concrete next step agreed at the end of a consultation. You'll have heard follow-up before on this channel. A follow-up plan is that idea made concrete. A specific date, a specific appointment, not just come back if it doesn't improve. Example: let's put together a follow-up plan before you leave. 5 things to take away from that consultation. Point 1. Why this topic and why the register matters. As we mentioned briefly at the start, mental health is one of the topics OET speaking candidates most often lose marks on. Not because the vocabulary is hard, but because the register is. This episode is really a masterclass in that register. And notice the contrast with last week. Episode 11 was audio only, high pressure, a parent on the phone at midnight. This week, face-to-face, booked, unhurried. 2 completely different registers, both essential for exam readiness, and both directly relevant to IELTS healthcare speaking at 6.0 and above.
Point 2. One open question at a time. Listen back to the consultation and count how many times the clinician asked 2 questions in one turn. The answer is 0. Every question stood alone. Can you tell me about your sleep? Then a pause, then the next question, only after the patient had finished answering. Stacking questions, such as, how's your sleep and has your appetite changed, is one of the most commonly cited errors in mental health role plays. 1 question, 1 pause, 1 answer.
Point 3. Validation is not agreement, and it is not, I understand. There's an important difference between empty reassurance and genuine validation. I understand, on its own, is a filler. It closes the door. That sounds really tough, opens it. It makes sense that you'd feel stretched thin, tells the patient you've actually heard what they said. Examiners notice this. Real patients notice it even more.
Point 4. Self-referral, and where this depends on the country you're in. Quick note for those of you working or preparing to work in different systems. In the UK, NHS Talking Therapies is a genuine self-referral service, no GP needed. In Australia, the Better Access scheme usually requires a GP referral for the Medicare rebate. In Canada, access depends heavily on the province and often runs through an employer's employee assistance program. In the US, it's largely insurance-dependent. Some plans allow direct self-referral to a therapist. Many don't. The vocabulary is the same everywhere. The pathway is what changes.
Point 5. Framing without diagnosing. You heard the clinician say, "This could be a number of things. I'd rather we explore that together than put a label on it today." That's not a dodge. That's a modelled clinical phrase worth learning. In a first assessment, naming a diagnosis before the full picture is clear can do more harm than good. The skill is holding the space open, offering concrete next steps, and resisting the urge to label too early. For OET Speaking, this is one of the clearest ways to show clinical reasoning without overstepping.
5 points. That's the breakdown. Now the quiz, Nadia. Ready?
Ready.
Question 1. What's the difference between low mood and a clinical diagnosis of depression, as this episode uses the terms? 5 seconds. Think before you listen.
Low mood is a persistent flatness or sadness that doesn't lift. It's more than a bad day, but it's not a clinical diagnosis. This episode deliberately never names depression. The clinician describes what Emma is experiencing without putting a diagnostic label on it. Low mood is a presentation, not a diagnosis.
Question 2. Name 3 things the clinician asks about beyond mood itself to understand how the patient is coping. 5 seconds.
Sleep, appetite, and concentration. Those are 3 of the standard functional impact questions in a mental health assessment. The clinician also asked about coping strategies, what the patient was already doing to get through the hardest days, and about anxiety, that persistent background worry. But sleep, appetite, and concentration are the core 3 you'd hear in almost any initial assessment.
Question 3. What's the difference between follow-up and a follow-up plan, as explained in this episode? 5 seconds.
A follow-up is the general idea of checking in later. A follow-up plan is that idea made concrete. A specific date, a specific appointment, written down and agreed before the patient leaves. Not come back if things don't improve. A named next step.
3 questions, 3 clear answers. The PDF transcript has all 10 vocabulary terms, the full dialogue, and the language notes. Link in the description.
That's episode 12. Emma's got a plan, and Jamie's doing just fine. Next time on Medical Voices, a very different kind of consultation and a diagnosis that changes someone's whole daily routine. See you next week, Med Nomads.
See you next week.